Hi everyone, Dr. Michael Miyazaki here, and today we're going to talk about how dentistry is becoming proactive because we can do it now. And so, over my decades of being in practice, when I was in dental school, we were taught to repair teeth, and we tried to teach our patients better hygiene. We had fluoride and all the different things to try to prevent decay, but did they ever do it? Not really. Only if you answer yes to any of these questions should you spend the time to listen to this presentation. Do you have teeth or implants? Do you have loved ones, like children, that have teeth? Do you or your loved ones' gums ever bleed during your regular daily oral hygiene regimen? Do you wish your teeth were whiter? Does your breath stink, or have you been told that it stinks? Do you worry about your overall systemic health? And would you like to stabilize revenue from your hygienist or your hygiene department, depending on what kind of office you have? If you answered yes to any of these, then the information we go over today will benefit you, at least I think. Healthcare has been very reactive. We wait until we treat disease, until we can diagnose disease. But change is coming. With the early detection potential, we can figure out where disease might occur and then proactively take action to prevent disease. That takes education, engagement with our patients, and then I hope if we have to do anything, it's a minimally invasive treatment or maybe minimally invasive prevention, because that's key. And today, these tools are available to us, but we need the knowledge. Because a lot of us have gone to dental school. We know what to do when there's a cavity. We know what to do when there's a broken tooth. But when it comes to prevention, we need, I think, a little bit of enlightening. So Vista Apex Solutions has a bunch of different products. We have the Regen Restoratives, which I have done many presentations on. And why was that developed? Because we know that if we restore a tooth with, let's say, a class 2 composite, it's very likely that we're going to get recurrent decay at a margin down by the gum line where it's very difficult for the patient to clean and the acids build up and we get recurrent decay. Vista Apex has PerioProtect trays, and the Perio trays are very effective at delivering hydrogen peroxide underneath the gum where the patient cannot clean with floss or a toothbrush. Vista Apex Solutions also has Parasciences, some great antioxidant oral healthcare products to help our patients. And then in our office, what we're doing is we're using some different adjuncts now, like Pearl, the AI for our radiographs, and then IOBio, which I spoke about not too long ago, which is artificial intelligence of the biofilm. So now we're at this point in dentistry where we can see things earlier, we can treat things more minimally invasively, and then we can protect the teeth, and then we can maintain the teeth. And I think this is what excites us in our practice because we're really implementing what I'm going to present today. So as far as seeing, the AI really helps us to see, and then it speaks for us. So, before I'd put a radiograph up on the monitor in the operatory, and the patient would just see white and gray, black and white and gray, basically. And the patients, how many of you have heard the patient say, well, those look like toes? And so they don't even understand what the anatomy is, and we try to get them to see the dark areas, and that's decay, and they don't really understand. But now we use AI technology, so when we put these images up, we can then have the AI technology show us where we're losing bone, and where that fuchsia color is, that's an area of decay. And now I need to take care of that for you and do a filling. And so it's almost like a third party there with us in the operatory. It's a non-interested third party, right? So that third party marks out that there's a cavity there, we need to get you back. And then I have to explain to the patient, and let me just explain to you why we need to do that now, because the white area, that's the enamel, the hard shell of the tooth. The green area, that's the dentin, kind of the insulation between the hard outer shell and the nerve is that purple area, and it's starting to get into that soft insulation. It's going to spread, so we need to take care of it. Another tool that we've just started using in our office is biofluorescence technology. Why is this important? Because the biofluorescence detects and shows us and our patients where the biofilm is. The areas that have biofilm are more likely to either have disease or develop disease. So gum disease, right, the biofilm that gets down into the sulcus, down to the bone, biofilm on the teeth, white spot lesions or decay, and then even on the tongue. If we have a lot of biofilm on the tongue, that could be one of the reasons why we have bad breath. So here's some biofluorescence. Here's the bicuspid with the white light technology, and you can kind of see on the distal side of that bicuspid, there's a little bit of decalcification, but when we use the red biofluorescence, now that stands out. And we snap an image and I show that to the patient. The patient says, why is that red there? Well, remember, the red indicates where the biofilm is or the bacteria is, and look at all the bacteria that's trapped between those teeth. So we go in there and you clean it out, and sure enough, that's where there's decay. And we can actually show the patients that the decay was there with our biofilm technology. It's basically the one that we're using right now is like an intraoral camera. So here we take our intraoral camera, we show that molar. Now the molar doesn't look that bad, but the patient may be symptomatic there. You know, when I bite on that tooth, when I eat something really hard, it's a little tender in that tooth. So we have our intraoral camera, but let's look at the biofluorescence technology that will point out where the bacteria is, and you can see where the cracks are and how deep those cracks are. And those cracks aren't just superficial, but now the biofilm is getting inlay, and you look at that tooth, and sure, you can kind of pick up some craze lines, which would be very hard for our patients to see. But now we use our biofluorescence, and now they can see the cracks, and the cracks light up with the red. And so a case like this, we might think about doing a crown. Now that might seem a little aggressive, and I was talking about minimally invasive, but what happens to a crack like that if it goes down further down apically, then that ends up to be an extraction and perhaps an implant or nothing. And that's, I think, even more invasive to our patients. Whereas if I just did a crown to hold that tooth together, that'd be a minimally invasive choice. Or if I have a patient that comes in and we try to point out the plaque, you know, this tooth colored, it's kind of white, and we point out that's the bacteria there, and the patient says, well, okay, I guess I see it. But then we light it with our biofluorescence, and what do you see? You see that red glow, and we tell the patients, those are the areas we have to get clean, because you're either going to get gum disease, or you're going to get a cavity, decalcification, softening of the teeth, or bad breath if it's on your tongue. So what do? We may elect to treat it. So if somebody has biofilm that's causing gingivitis, periodontitis, maybe periimplantitis, then I go to the PerioProtect trays. So the PerioProtect trays are FDA medicinal delivery devices that will actually fit so tightly around the cervical area of the tooth that when we fill this out with hydrogen peroxide gel, 1.7%, it'll actually squeeze that hydrogen peroxide down into the sulcus. And by squeezing it down the sulcus, we can break up the biofilm. Now, it might take, if there's a lot of biofilm down there, it may take a couple weeks for this to occur. So what I do is I have the patient, if they've got deep biofilm or aggressive gingivitis, periodontitis, I'll have them do that morning and night. You could do 3 times a day, but a lot of times people who work have a hard time doing it at lunchtime. So I'll just tell them, hey, in the morning when you're getting ready for work, taking a shower, put the trays in. At night when you're getting ready for bed, maybe taking a shower, put the trays in. 15 minutes twice a day when they use up a tube of Perigel. And then after that, just once a day. So it's not very difficult for them to follow that. But what we're doing is we're using the red fluorescence to detect the biofilm, and then we're actually using the PerioProtect trays to deliver hydrogen peroxide to handle that biofilm. Now, radiographs are fine, something like Pearl, but by the time it's noticeable on a radiograph, we've already had something happen. We've already had bone loss, or we've already had a cavity develop. And what we're trying to do is we're trying to prevent that from happening right now. And today I watch a lot of programs or read about programs where we can be site specific. Oh, if I take a radiograph and the AI technology with my radiographs, I see a cavitation or an early area of decay, maybe I can apply something to that area to help that tooth heal up in that area. Well, the problem with that is, why site specific? If I'm getting a cavity in between a molar and a bicuspid, why would I not get it everywhere else? So again, what we would do is we're doing full mouth detection. So when I'm using my intraoral camera, I can go throughout the entire mouth fairly quickly, find areas that glow red, and especially if it's in the gum area, What I want to do is I want to do full mouth protection with full mouth treatment, not site specific, where I treat one tooth or one area of the gum. I'm going to treat the entire mouth. At least I think that that's more efficient. And so take your favorite gel, maybe it's a remineralization gel, put that in your PerioProtect tray and wear that tray. Do that a couple times a week. Why is that better? Well, because I've seen some other treatments where you put something between the teeth, and like whitening, I believe it's like contact time. You know, the more contact time the bacteria has with our teeth or our gums, the more damage can be done. The more contact time my gums have with hydrogen peroxide, the healthier they're going to get. The more contact time my teeth get with a remineralization gel of some sort, the better healing that I'm going to get. And there's going to be some exciting new developments, and I'm going to have to remake this video in weeks to months. And so we're going to be able to give you something to help. So if I see it early, I can treat it or protect it. And then how do I maintain it? Well, that's where Parascience's oral health care products really come into use. They're antioxidant smile care formulas of a toothpaste, a gel. So if you've got any kind of sores, or if you have surgery, that gel is going to be very effective to help that area heal up. And even toothpaste for sensitive teeth. And you can mix and match these products to create the perfect mix for you. Okay, so how does this work? Patient comes in, hygiene visit or new patient visit. We do the biofluorescence scan. They see the biofilm, and we explain to them that that biofilm is bacteria. Those are the areas you're most likely to get disease, cavities, demineralization of the teeth or softening, or even gum disease. So what we would like to do is enroll you in a prevention program. Now, my hygienists are getting really good at using the cameras, the intraoral camera, and showing the patients because they think it's so cool. My hygienists do. They think it's so cool to be able to show the patients what's going on in their mouth. Then the initial treatment, let's get the teeth cleaned up. And if we think it's appropriate, we'll get them enrolled in PerioProtect trays with the PerioGel. And again, we'll get to the point where they're just using it daily for 15 minutes. That PerioGel's going to help the patient have whiter teeth, fresher breath, and healthier periodontal health. If we find that there's areas where maybe there's demineralization or early decay, we can use gels to remineralize those areas. And so again, I might use the PerioProtect trays, and 2 or 3 times a week have the patient do that in the evening, is fill the tray up with the gel, put the trays in for 15 to 30 minutes, and then take the trays out. And then we can also have them use the antioxidants defense products from Parascience. Use that daily just to keep the systemic oxidative stress reduced to give them better oral health. And then what are we going to do? We're just going to monitor. So if the patient's coming every 3 to 6 months, we're going to use the camera to hopefully show them that the red fluorescence is starting to decrease because now they should have better hygiene. They're clean better at the gum. There's less bacteria underneath the tissue in the sulcus. There's going to be less bacteria in all the nooks and crannies of the teeth because that hydrogen peroxide is going to get into the nooks and crannies, not only the sulcus, but also the teeth. And what we can do is we can begin to show the patients what the trends are. Here's the red glow that you had at the first visit. Here's what it looked like 3 months later. Here's what it looked like 3 months after that. And hopefully they're going to start to see an improvement. And we can use what we call multichromatic or multicolor analysis to track how well the teeth are actually remineralizing over time. So this is why we're so excited about this technology, because today we're implementing this. With the red biofluorescence, I'm able to show patients how their teeth are. I can show them cracks, I can show them bacteria, and the patients just come up with their own diagnosis. They've got their own concerns. Why is that area so red? What are we going to do about that red area? And they're involved, they're engaged, and I think that's what really makes it fun for us to work with the patients. So what it does, it distinguishes you and your practice as being different. And you know, when they come in for that cleaning, it's so much more than a cleaning. We will retain more patients because it's hard to go anywhere else once you've gone through that system to go anywhere else where they just clean your teeth. Those patients are going to be excited when they leave your office, and they're going to tell their friends and family about the experience that they just had in your practice. So you're going to see more new patients. And each visit with your hygienist is going to develop most likely more revenue, because they're going to value the services that you offer. You can bundle these products up. You can have the Perio trays. You could have the PerioSciences products all bundled up. And you might even bundle up with, like we do in our practice, your practice membership. And ultimately, what's going to happen is your patients are going to achieve better health. They're not going to have invasive procedures anymore. We're going to try to become minimally invasive. And I think for all of our patients, that's a good thing. Now, I know there's going to be clinicians worried, well, if our patients don't have gum disease and they don't have cavities, what are we going to do? So I assure you, you're going to be busier with a more fulfilling life, providing services that excite you and your patients more than just doing fillings all day. So see it, treat it, protect it, and maintain it. That biofluorescence helps us detect invisible biofilm and track down early disease before the symptoms arise. The PerioProtect with the Perigel helps to target that deep biofilm in the periodontal pockets that the patient can do at home, non-surgical. The regen restoratives that use the bioglass to create an alkaline environment and prevent secondary decay around our restorations is where this started. And now we're going to have the trays with gels that can help the teeth actually heal up. Full mouth, not just site specific. And with PerioSciences antioxidants products, we can have oral health and systemic health by promoting healing using antioxidants in our oral care products. So today, this system offers patients early detection, full mouth minimally invasive treatment, long-term protection, and overall whole body health benefits. I think that's what everybody wants. So I hope this gets you excited. I hope you want to learn more, because we're going to be bringing you more information in the coming weeks. So thank you very much. And just remember, we're creating this community of like-minded clinicians who are trying to do our very best for our patients. And if you like this information, hit the like button. If you want to make sure you don't miss out on that information I told you that's coming out, that I'm very excited about, hit subscribe. And I will see you again in the next episode. Thank you very much.